Om Swastiastu. Good morning. We're from SGDB 7, the third semester of PSSK 2021. Today we'll present our student project presentation, which title is Rheumatic Fever. Next. These are our members. Next. Now we will begin with Chapter 1 Introduction.
Okay, let me introduce myself. My name is Prasatya Wijaya with the last digit of student ID number 227. And I would like to explain more about the background of why we made this student project. Rheumatic fever is a type of autoimmune inflammatory disease that progresses as a sequelae to group A beta hemolytic streptococcal infection. This condition mainly affects children and young adults, particularly those between the age of 5 to 15 years old. Rheumatic fever is quite common, especially in poorer nations like Indonesia. The patients suffering from rheumatic fever have an escalated risk of developing complications, including carditis, arthritis, and chorea. In addition, rheumatic fever is also a common cause of acquired heart disease in children all around the world. About 60% of people who suffer from rheumatic fever in endemic nations develop chronic rheumatic heart disease. The incidence of rheumatic fever is directly correlated with poor socioeconomic condition. The majority of people suffering from rheumatic fever originate from regions with limited access to medical care, such as in developing countries. Because of the particular easiness in which bacteria can spread in crowded place, overcrowding also contributes to the spread of rheumatic fever. The diagnosis of rheumatic fever is entirely clinical, without any gold standard test, and no treatment is able to effectively reduce the progression of rheumatic heart disease. Therefore, more research is needed to realize the decrease of rheumatic fever morbidity, the increase of diagnostic sensitivity, and to attain a real detection of the disease. That's all from me. Thank you.
Good morning. My name is Putu Krishna Arasawardhani Putri with last digit number 027, and I would like to present about the problem formulation, objective, and benefits of the student project. So the problem formulations of the student projects are: what is the definition of rheumatic fever? What are the current findings on the epidemiology of rheumatic fever? What are the etiological factors of rheumatic fever? What is the pathogenesis of rheumatic fever? What are the symptoms, clinical manifestations, and diagnostic criteria of rheumatic fever? And what are the treatments, prognosis, and prevention of rheumatic fever? Next. The objectives of these student projects are to know the definition of rheumatic fever, to learn more about the epidemiology of rheumatic fever, to understand more about the etiological factors of rheumatic fever, to gain more understanding about the pathogenesis of rheumatic fever, to gain more comprehension regarding the symptoms, clinical manifestation, and diagnostic criteria of rheumatic fever, and to gain more knowledge of the treatments, prognosis, and prevention of rheumatic fever. Next. Okay, next is the benefits of this student project. The benefits of the student project for the writers are: this paper can be used for educational purposes, practicing and developing skills in conducting research, and improving literacy skills by searching through dozens of journals. For the institution, the benefits of the student projects are adding sources of knowledge, especially about rheumatic fever, as a learning material to introduce rheumatic fever to students, and it can be used as a reference for conducting research. And lastly, for the public community, the benefits of these student projects are to introduce to the public about rheumatic fever, increasing public awareness about rheumatic fever, and it can be used as a guide to understand the general knowledge regarding rheumatic fever. Thank you.
Okay, good morning, everyone. My name is Nikita Devi Prasiti with last three digit number 028, and now I would like to explain about the definition of rheumatic fever. So rheumatic fever is a fever that caused by an autoimmune reaction to group A streptococcal or GAS infection called Streptococcus pyogenes. Polyarthritis and valve regurgitation are common manifestation of the condition, which is characterized by various degrees of inflammation of the heart and joints. And the socioeconomic status of a country largely determines the occurrence of acute rheumatic fever. And in high-income countries, the disease is no longer a public health concern, but there are still sporadic outbreaks. That's all from me. Thank you.
Good morning. My name is Marta, and my last digit of student number is 064. Now I'll talk about the epidemiology. Cases of rheumatic fever have actually decreased in recent decades, but many cases are still found in developing countries because of several factors such as the low economy of the community, inadequate health services, and the dense environment. Research conducted globally shows that there are 471,000 cases of rheumatic fever each year that occur in children aged 5 to 15 years old. In Indonesia, the prevalence of rheumatic fever cannot be ascertained, although there have been studies showing that the prevalence of rheumatic heart disease in school children ranges from 0.3 to 0.8 per 1,000 people. The incidence of rheumatic fever in men and women is actually similar, but some studies show that women have 1.6 to 2.0 times higher risk than men. Approximately 60% of patients with rheumatic fever have complications of rheumatic heart disease. Rheumatic fever can recur due to association with the heart, such as carditis and other cardiac abnormalities. The incidence of recurrence of rheumatic fever tends to be high in people with a history of heart disease. A person with a family history of rheumatic fever has a 5 times greater risk. That's all from me. Thank you.
Okay, my name is Happy Q Sumamulya with the last three digits number 151. So here I would like to present about the etiology. So the most cause of rheumatic fever is bacteria named group A Streptococcus that can develop into strep throat, scarlet fever, or impetigo if the case management is not done properly. This bacteria will give a signal to the immune system to react by inflammation, and early stage of strep throat or scarlet fever occurs. Rheumatic fever can affect all ages, but more common in children between 5 to 15 years old, and the crowded, also the gatherings place has a probability to spread the group A Streptococcus, for example, in schools, daycare, and military barrack.
Okay, hello. Thank you for the opportunity. My name is Nur Tramsiri with last three digit of my student number is 135. Now I will explain about the pathogenesis of rheumatoid fever. Next. Okay, so pathogenesis of rheumatoid fever. The pathogenesis is start from infection with Streptococcus pyogenes in the pharynx. The antigen, the Streptococcus pyogenes, can create a mimicry mechanism, and the mimicry mechanism can make a humoral and cell-mediated autoimmunity. The autoimmunity can lead to rheumatic fever. This process is took about 21 days from the onset of infection of Streptococcus pyogenes to the rheumatoid fever. Autoimmune reaction from rheumatism will appear when antibodies from group A beta hemolytic Streptococcus react to the heart. In an acute rheumatic fever reaction, several cytokines such as interleukin-1, interleukin-6, and tumor necrosis factor alpha will occur that trigger an inflammatory response. Okay, that's all about pathogenesis of rheumatoid fever, and that's all from me. I give it to my friend. Thank you.
My name is Ida Karenjana with the last digit number 246, and I will be explaining about the symptoms of rheumatic fever. So the symptoms of rheumatic fever are sudden sore throat and odynophagia, fever, headache, scarlet fever rash, nausea and vomiting, hyperemic tonsils and pharynx, exudates from tonsils and pharynx, petechia of the soft palate, swollen and hyperemic uvula, and previous exposure history. That's all from me. Thank you.
Good morning, everyone. My name is Vladimir Kolobisono with the last three digits of student number 061. Next. Now I'll present about the diagnosis of rheumatic fever. So rheumatic fever is diagnosed based on the medical history, physical examination, and certain test results such as laboratory examination in the patient. And the diagnostic standards for rheumatic fever have evolved over time. And based on the World Health Organization, there are 3 episodes for the rheumatic fever, which are primary episode, recurrent episode, rheumatic chorea with chronic valve lesions. And the major criteria and the minor criteria of the diagnostic standards of rheumatic fever is based on the Jones criteria. And so a confirmation of two major criteria, or one more major and two minor criteria is necessary, coupled with the proof of GAS infection to determine whether a patient has rheumatic fever as a primary episode. Also, it takes either two major criteria, one major and two minor criteria, or three minor factors to diagnose rheumatic fever in recurrent episode. And there are some diagnostic tools for rheumatic fever, such as echocardiography, erythrocyte sedimentation rate, and C-reactive protein level to determine the diagnosis of rheumatic fever. That's all from me. Thank you.
Hello everyone, my name is Natania Catherine Sudaya with real last digit of student number 175, and I'm going to explain about the clinical manifestation of rheumatic fever. Next. There are a few criteria that includes major and minor manifestation of rheumatic fever divided into low risk population and moderate to high risk population based on the regions that can be seen at the table. The major criteria is carditis, arthritis, chorea, erythema marginatum, and subcutaneous nodule. The minor criteria are polyarthralgia, fever, elevation of ASR and or CRP, and prolonged PR interval. The major criteria of clinical manifestation of rheumatic fever include arthritis, inflammation of joints which are frequent in several joints including knee joint, wrist joint, ankle joint, and elbow joint, carditis, inflammation of heart layers and valves within, chorea, involuntary body movement usually in face and limbs along with muscle weakness and speech disturbance, subcutaneous nodules that are firm deposition of collagen fiber, and erythema marginatum, pinkish macular and papular lesion with dark color boundary and faded at the center that appears in the trunk, abdomen, and proximal extremities. That's all from me. Thank you very much.
I will continue the presentations. My name is Luis Felix Yuanda with the last digit of the student number 117. Next. I will speak about the treatment. First, I will explain about the goal. The goal of the treatment for rheumatic fever is eliminating group A streptococcus or gas, and then reducing the symptoms, and then preventing the complications and recurrence of rheumatic fever. For the gas infections, the drug of choice is penicillin. We use penicillin because most of the gas strains is sensitive to the penicillin. And then for the mainstay therapy itself for the rheumatic fever is symptomatic supportive care. So we treat the patients asymptomatic by the symptoms. For the fever, we usually use paracetamol. Sometimes we can use aspirin if we sure about the diagnosis. If unsure, we use paracetamol because aspirin could interfere with the diagnosis. And then NSAID or non-steroid, we can use aspirin. This is used for mild carditis and without congestive failure. If the patient have moderate to severe carditis or congestive failure, we use steroid because steroid have more potent immunosuppressive effects.
Good morning. I'm Gregor Sulamjong Pratama with last three digits of student number 085. Now, I will explain about the prognosis of rheumatic fever. Several diseases could develop as part of rheumatic fever. Valve regurgitations as a complication of rheumatic fever is related to mild to moderate carditis. The situation could be stable and get better 12 months after diagnosis. Despite someone with severe carditis are at high risk of developing chronic rheumatic heart disease, heart failure, infective endocarditis, pregnancy complication, stroke, arrhythmia, and premature death. Rheumatic fever could manifest early symptoms such as arthritis. Rheumatic carditis could be congestive and chronic, rheumatic pericarditis, syndrome chorea, and gangrene. In addition, syndrome chorea is a late manifestation of acute rheumatic fever, characterized by involuntary movements that commonly involve the face and extremities. That's all from me, and thank you.
My name is Ariela Krisarjo with class digit M247. Now I will explain about the prevention of rheumatic fever. Next. Prevention mainly relies on the prompt recognition and treatment of streptococcal pharyngitis and avoidance of recurrent infection using long-term antibiotics. In the absence of vaccine, primary prevention of rheumatic fever is antibiotic treatment of strep A infections to reduce the risk of developing rheumatic fever. Primary prevention involves the identification of strep A infections and delivery of appropriate antibiotic treatment to prevent rheumatic fever by shorten the duration of infection, heal the source, or provide symptomatic relief. The evidence that treatment of strep A throat infection can prevent rheumatic fever is strong based on historic studies. Prompt treatment with oral penicillin is reported to reduce the attack rate of rheumatic fever following strep A throat infection by approximately 70%. Current strategies focus on primary prevention with early detection and early treatment of group A streptococcal infections. I guess that's all from me. Thank you.
Thank you for the opportunity. My name is Jennifer, with last three digits of student number is 101. Next, in conclusion, rheumatic fever is caused by an autoimmune reaction to a group A streptococcal or gas infection called Streptococcus pyogenes. Research conducted globally shows that there are 471,000 cases of rheumatic fever each year that occur in children aged 5 to 15 years and rarely occur in those over the age of 30 years. The appearance of acute rheumatic fever is usually preceded by group A beta hemolytic streptococcal pharyngitis. The antigen from S. pyogenes can create a mimicry mechanism that can lead to humoral and cell-mediated autoimmunity, which can then lead to rheumatic fever. Symptoms found in this infection are sudden sore throat, odynophagia, fever, headache, and etc. Next, the World Health Organization currently divides rheumatic fever diagnostic criteria into three categories, which are primary episode, recurring episode, and rheumatic chorea with chronic valve lesion. Based on major and minor criteria, the Jones criteria are used to diagnose rheumatic fever. The major criteria of clinical manifestation for rheumatic fever includes arthritis, carditis, chorea, erythema marginatum, and subcutaneous nodules. The treatment of rheumatic fever begins with the goals of eliminating group A streptococcus or gas, reducing the symptoms, and preventing the complication and recurrence. Next, for the recommendation, it needs further study because rheumatic fever continues to be a major cause of morbidity and mortality in low-income nations. It's also essential for the government and healthcare institutions to raise awareness about rheumatic fever and how to prevent diseases. By understanding the disease, the public can also avoid it and learn about the symptoms so they can detect the disease as early as possible and get early treatment for group A streptococcal infection. Next. That's all from us. Thank you so much for your attention and have a nice day.